Welcome back to 2 Wants to Know. Cone Health's Infection Prevention Medical Director, Dr. Cynthia Snider, is here answering your questions. This person is texting, what do hospitalizations look like for Cone Health right now?
So for over the last probably 3 to 4 weeks, we've been looking really good, knock on wood, where we've had anywhere from mid 50s to low 60s hospitalization across our whole health system. And then also that reflects what's happening statewide. You know, we've had just under 1,000 COVID hospitalizations throughout the state, and we haven't yet seen any pickup. And it might be still a little bit too early to see if any fallout from like Easter and spring break. But so far it's been steady. We're still hoping that the cases continue to trend down.
Yes. All right, this person is asking, after the second shot and 2 weeks wait after, should you get a COVID test to confirm it?
So we don't necessarily recommend folks to get tested to see if they have antibodies. The reason being is that not all tests that check for immunity will be structured the same, and some people make it like a false negative. So we don't recommend you to get tested. We suspect that you're still going to have a really good immune response to the vaccine.
This person, this is kind of a follow-up. Where do I go now if I do want to get a COVID test? Right now, I'm only seeing vaccine locations.
It seems like that, right? A lot of people, when they're looking up COVID, testing sites now, I think, are pretty accessible. You can even get them at local grocery stores or pharmacies. And so I would go there first.
And you can do them online first to get your appointment, and you just are able to go in there pretty easily. All right, this person is saying, does the vaccine actually prevent the COVID-19 virus, or does it just lessen the effects?
So it's a bit of a combination of both. So it is a very effective vaccine to prevent severity of illness, as well as prevent getting the disease process at all.
And this is a question about the Johnson & Johnson shot, especially since we've seen what we've seen in the news the last couple of days. Are people getting sick from the Johnson & Johnson shot?
So looking, there was a bit of a scare last week, and the North Carolina State Health Department looked into it, as well as the CDC, looking at some of the reactions that happened on site. But it is not thought to have more side effects than others. There's thought that maybe at the site people had like, I guess what we consider like in the realm of fainting or vasovagal. So the key thing right now, as it's getting warmer, making sure to stay hydrated. If you're prone to having low blood sugar, make sure you eat, stay hydrated, and then go to get your vaccine.
This person's asking, must an adult accompany a 16-year-old to get their vaccination?
So I don't believe so, but the key thing is that when somebody who's 16 and older getting the COVID vaccine, they should be getting the Pfizer one. That's the one that's they're allowed to have at that age.
Okay, and these are two kind of questions. How long should you wait after recovering from COVID to get your vaccine? And then why do I need a vaccine if I've had COVID?
That is a good question. There's in some scientific realms, there's a lot of debate of when to get your vaccine and then possibly which one. So the thought is, initially when somebody had COVID, we do suspect you have at least 3 months of immunity. Back when we didn't have as much vaccine available for everybody, we asked those who had COVID to wait. But now that the vaccine is widely available, if you have recovered, you can take it as soon as like a few weeks after you've been recovered from having the disease process.
All right, this person is asking, if I have received both of my shots, is it safe for me now to go to church?
So you are safe. You have more immunity. It really depends on how your church is set up. I worry if it's indoors and folks are closer than 6 feet from each other. If your church services are outdoors, I think that is probably the safest bet.
All right, now someone's asking, does Medicaid pay for COVID shots, but the shots are just free?
Correct. So it doesn't matter. We don't care anybody's insurance coverage. We just want you to come in and get the vaccine.
Yeah, they don't ask you for that.
Correct. There's no ID being checked at any of the sites. So we want to make it seamless. There's no billing. We just want to make sure that you're older than 16 to get the vaccine, and please come on and get your shot.
And to clarify, that's for like the Cone Health vaccination sites. Now you may go to like a CVS or a Walgreens and they may ask you for something like that, but definitely not at the Cone vaccination sites.
Correct.
Okay, great. And one last one, it says, should a fully vaccinated person be afraid of getting around an unvaccinated person?
It really depends on what that unvaccinated person is doing, right? If the person you're with that's unvaccinated is doing a lot of other activities without wearing a mask, they potentially, right, may be at risk of having it while they meet you. So that vaccine status helps you a lot, protects your immunity. It's not 100%. So I still think there's definitely some merit with wearing a mask.
All right, thank you so much for your time. Now, if you missed any of this, you can find it on our website in the Who Wants to Know section.